start, let me say something. I walked in earlier and I heard a strange sound. And I don't know, it was a little scary, and I was going to share that with you. I wasn't sure what it was, and I was trying to find a descriptor for what that sound was all about. And after a while, it came to me. It's a growling sound, and that growling sound is emanating from the collective stomachs of all of you. So I know lunch will be served, and I clearly understand standing between the audience and lunch is a death wish for a speaker. So the lunch will be served momentarily. So pleasure being here. Thank you for having me. To the left of me, you see Derek. Derek is from ImageThink, and he has a poster board, and he will be continuously drawing what we're saying, so you can actually take snapshots and pictures of it afterwards. And he will continue in the next session as well. So please take advantage of it. It'll be hopefully very insightful to you. My name is Michael Jarjour again. I am the CEO and president of ODH. What do we do? We're actually located in Princeton, and we focus on integrating and aggregating fairly complex data sets from claims data and other healthcare-oriented solutions and data sets. We then add to that risk stratification and some critical insights, and marry that up with proprietary, again, what we call insights into actions. So we give, if you will, our audience the capability to truly understand what are the modifiable behaviors that you should enact with a certain patient population to successfully reduce costs and impact outcomes. So on the next slide, you already heard about the fact, death by spreadsheet. And that was actually coined by one of my colleagues who worked on the payer side, and she was managing a team of care coordinators. And the challenge for her was, if she wanted to understand which patient population required care coordination, she would ask diverse IT colleagues to print out data and spreadsheets. And she would lay them out on a large conference table and then try to follow through a certain patient across multiple spreadsheets and systems. And needless to say, that was a significant death or challenge for her, if you will. So those three words, if you will, truly define the plight that many of the managers and care coordinators in the healthcare world experience. So with multiple IT systems, and many of them are legacy systems, it's extremely challenging. It's a daunting task to aggregate that data set, and then essentially ultimately also analyze and segment out the targeted data set. Let me give you a perfect example in terms of diverse systems and how to integrate them and create interoperability. Many of you know EHR or EMR systems, electronic health record systems. And they were actually enabled by the Meaningful Use Program and the incentives associated with that. So you have a nice proliferation into the market. Nearly 90% of providers have what you call an electronic health record solution. 4 years ago, there were about 500 EHR vendors. Today, there are in excess of 1,100 systems. And think about integrating that data set. There are some interoperability resources or capabilities created. Many of you may have heard of HL7, and that's now being succeeded by FHIR. But that's still very much a challenge and fairly unrealistic in assuming that there's perfect interoperability that allows people to glean data from all these diverse data sets. So as we talked about this being a significant barrier, interoperability we talked about is a critical component. If you think about the audience, accountable care organizations who view health record interoperability as a critical component of their success in terms of improving outcomes and maintaining or reducing costs, 3/4 believe that it's a significant barrier and it's not reality even today. So everyone talks about integrating data. We did our own survey at one point, and we found that 80% of healthcare companies say data integration is critical, but less than 50% actually have integrated all the medical claims data and other data sets. So that's where population health management solutions come into play, because collectively we are trying to resolving such an issue. So let's take a hypothetical. In this case, there's something about Mary. Many of you have seen the movie. It has very inappropriate concepts in that movie, but this is not what we're talking about today. So Mary is a patient, and right now she's identified as having hypertension and congestive heart failure. Fairly challenging stuff. And actually, technologically and medically, she's well served already. She has in her home a pulse oximeter, she has a scale, she has a digital scale that actually reports everything out, she has a blood pressure monitor. All this information is conveyed to her physician and her care management. And in this case, these interventions are having an effect. So medically speaking, things are improving. Is everything well? I hear that Jeopardy sound behind me. Nah, no, it is not. Let's take a closer look at Mary. So there are other components that are impacting her health. She has a history of depression and anxiety. So imagine, many of you may know people who are depressed, but severe depression is truly disenabling. If you will, patients have a difficulty getting up in the morning out of bed, much less take their medications. She lives alone, she doesn't drive, she has impaired vision. Think about impaired vision and trying to identify which medication I should really take. She has a drinking problem. That drinking problem has an impact on whether or not, if she's taking her medication, it can actually impede the efficacy of the drug or have other issues that are associated with concomitant use of alcohol with drugs. She also recently had a fracture, a hip fracture. Because of her impaired vision, she fell down the stairs. And for those of you who don't know, there's a study done by NIH. For people in her age cohort, if you have a hip fracture, the study was done to actually follow up with patients for about 3.7 years on average. And after hip fracture and surgery, at the end of the follow-up period, which ranged up to 9 years, 80% of that population experienced mortality. So it's critical that we find ways by which we can truly impact the health, not just from a medical perspective, but from a behavioral perspective, from a holistic perspective, adding other data sources, social determinants, criminal justice information. All of that is far more critical than just looking at purely from a medical perspective. So if you look at Mary's behavioral issues, had they been integrated with a care management solution, could the complications she suffered have been impacted? Well, the answer is yes. So think about a platform that would allow for predictive analytics measuring risk, correlations across a wide range of comorbid behaviors. That could have informed her provider. It could have informed her care coordinators. It could have informed her family to truly impact the outcome. So a population health platform or technology platform would, in connecting the dots across multiple components, be it the pharmaceutical activity, her care history, what social determinants are impacting her, and most importantly also what interventions can help improve the care. So if you think about the focus of healthcare transformation, it should not just focus on physical health. You have to add behavioral health, you have to add all these other components to it. So if you look at patients like Mary, she's suffering from the fact that it's fragmented data, and obviously based on the fragmented data and lack of insight, costs go up, outcomes suffer. So we can leverage technology to help get us there and improve that. We can identify evidence-based care that can inform the entire continuum of care to help her get better outcomes. So we need, if you will, integration. And so what are some of the key elements of integration of such data points? We need a capability of sharing information, so shared information systems that facilitate the coordination. Screening for depression. There are a lot of screening tools that are available that can provide insights into the behavioral health status of the patient. Team-based care, and we're not just talking about now the provider and potential therapists, it's also the family that has a critical play in this. If they're informed, they can impact the outcomes. standardized guidelines, and a systematic review and measurement of the patient outcomes that can have then ultimately, again, a significant impact. So if you think about all these ingredients, and if we were to be able to enable them, that would now help enable the transition to what nowadays is called value-based care. For many of you who may or may not know this, if you go to a provider right now, commonly a provider, a clinician takes care of you, and there's a fee for service they get based on whatever services they rendered. Well, this healthcare world is transitioning to value-based. So now it's not just about pay for volume or pay for a certain interaction. It's now pay for outcome. And so that's a critical transition. And to make that changeover, it's a daunting task. There needs to be far more alignment between the payers and the providers, which exists to some extent right now, but needs to be far more enabled. That communication flow has to be continuous and critical and insightful to be able to allow the clinicians to take on that risk. If they need to take on the risk, they need to understand what outcomes they're being judged on and what impact they have had. So there's a critical alignment between the providers and the payers. And this world, actually in this world, we're already seeing much of that. So I moved on already here. So we are seeing much of that already in today's world. If you've heard about, Humana just announced the acquisition or 40% interest of an investment in Kindred home care business. So that's starting to show that robust data sharing is critical to the success of driving outcomes. So this will also help drive patient and member/patient interactions using remote monitoring, telehealth, and other capabilities. And the goal there ultimately is also to arm the clinician with critical information to help close the gap on some of these conditions that they may or may not be aware of at the outset. You also heard of the $69 billion pending merger between CVS and Aetna. Again, it's all about data integration. It's about big data analytics and the ability to drive keen insights out of that data set. So if you really want to enact value-based care, what are some of the critical aspects of helping organizations transition to that? Scale matters. If you're small organizations, do you have the investment capability or the financial wherewithal to actually enable that? That could be a huge challenge. You need to invest in staffing and training. People need to think more about the outcome than just what kind of a fee I'm applying to that service. Partnership's going to be critical. Partnering with larger entities, partnering with entities that can help, like population health management companies or the likes of the new partnerships that I've just shared with you to really drive insights from data. Critical for the success of this. And you need to rethink about how to measure. Measurements are going to be critical. If I, as a clinician, am going to take on, or a provider, I'm going to take on the risk of impacting my remuneration based on what outcomes I can help drive, I need to know how I'm being measured. I need to understand what essentially will impact outcomes of the patient population. So with that said, in summary, summing it all up, a shift to value-based care requires a total change in culture. So we need to think about what kind of data, what kind of insights, what kind of technological capabilities can help drive that, and what kind of evidence-based medicine capabilities that we need to enact to enable value-based purchasing and contracting. Having the right people, the right skill set, cross-departmental approaches, and the management structure that really supports this transition is going to be critical. So with that said, it's a brave new world, and I'm excited to be part of it. And I thank you for your time.